doing breast cancer here at VCU. And one of the things I was thinking about to speak today is about breast cancer screening. I think it's really important, partly because breast cancer unfortunately affects a lot of us in the United States. We probably know a family member or a friend that's probably had breast cancer. It affects 1 out of 8 women in their lifetimes in the U.S., so it's really important. But we do have really good screening tools. I think this is a process that's really evolved over the last 30 years, where we actually are getting more folks screened. But sometimes it's really confusing when you look online. There's multiple organizations, multiple recommendations. I thought I'd at least kind of talk briefly about how they differ and why it's really important to talk with your regular doctor about how to screen, when to screen, and how to continue to screen. So if you look online, back in about 2009, the United States Preventive Task Force put out a recommendation. And this is for women of average risk. I'll talk about what average risk is in a little bit. But they recommended women to start their breast cancer screening with mammograms once every 2 years starting the age of 50. This was actually based off a lot of studies and trials and also recommendations from across the ocean in both in Great Britain and also in the Scandinavian countries. Now that's actually a decent recommendation. However, the one thing that we need to keep in mind, and I think also from the cancer societies, we're a little more conservative because our populations definitely are a little more diverse than what it may be over in Europe. So that's what we need to be a little more cautious about. So if you look at the American Cancer Society, their recommendations from 2015 recommend yearly breast cancer screenings for average risk women starting at the age of 45 to 55 once a year. And then after that, you can consider spacing out to every 2 years. There's no cutoff in terms of age, and I think this is something really important because age is just a number, and it's something that you really do need to work with your primary care doctor to figure out how long we should continue screening for. But if we took one step further, I think as surgeons and the surgical societies, including the American College of Obstetrics and Gynecology, the American College of Surgeons, the American Society of Breast Surgeons, we're a little more conservative. We actually start our recommendations at the age of 40, partly because we do see younger women being diagnosed with breast cancer, and we really want to get them screened and caught early because breast cancer is treatable and curable when they're early stages. I mean, we have fantastic ways to treat patients and keep it from coming back, but we gotta catch that early, and that's the important thing about breast cancer screening. In terms of what is an average risk person, that's a person that has no family history or personal history of breast cancer, hasn't had a prior breast biopsy before, and those are things that you should work with your regular doctor to figure out, are you an average risk person or a higher risk person where we would think about screening differently. Another big question when people ask us about screening is, how should we screen? We always hear about mammograms, but now we're seeing on TV or on the internet about MRIs or even this 3D mammogram, and what is 3D mammogram. So the really neat part about mammograms is that it's really been standardized and really elevated to make sure that we're all looking at the same thing in terms of regular mammogram, screening mammogram. And this was actually a law that was passed in Congress in 1990, which really has improved our ability to have access to screening. But over the years, we realized that each woman's different, their breast tissue is different. As we age, the breast tissue changes a little bit, and it's sometimes harder to see and detect smaller cancers. And so there are newer technologies, something called a 3D mammogram, or sometimes you might read something called tomosynthesis. Essentially, it's our version of a CT scan for the breast, where it's multiple mammogram x-rays that allows us to see that. Some societies do recommend that, but the best way to screen is a mammogram because it's covered, should be covered by your insurance, and it's an easy way to screen. It's still really effective. People ask about how about MRIs. I think this is a conversation you'll have with your regular doctor, as if you're a higher risk patient, higher risk for breast cancer, to consider that screening, and that's usually reserved for younger patients and patients that have a genetic disposition for breast cancers. The problem with MRIs is that it does take a while, and also they can actually cause a lot of anxiety because they can find things that are not necessarily cancer, and that's probably not necessary for some patients. So, but the big caveat with all of this is just to make sure that you talk with your primary care doctor each year to check in to talk about when you should screen for breast cancer and when you might consider spacing it out if it's applicable to you, or when to consider stopping screening. right, thanks everyone.
Thank you.